When the NHS was first introduced 75 years ago, there was actually a lot of opposition to it. Since then, it's become the envy of the world, until now, with 13 years of the Tories fucking it up and running it into the floor, which has changed all that. The idea of free at the point of delivery just isn't a reality for most people needing dental or optical care, and it's getting more like that across the board. The Tory party always says it supports the NHS, but it's got a bloody funny way of showing it. Waiting lists are above 7 million, and don't let them get away with blaming that on the pandemic. The lists were around 5 million before and rising. Rishi's made reducing NHS waiting lists one of his big five pledges, but now that doesn't look like happening, and we can hear him slowly moving the goalposts, saying it's the length of the wait that counts, not the number. And if he's not aiming for privatisation, why did he have a secret meetings with private healthcare bosses in America when he was Chancellor? And why are MPs from any party taking donations from private medical related companies? The problem is, these bastards just can't understand the NHS. It's not in their DNA to process why an organisation would provide a service and not try to milk the customers dry. They see everything as an opportunity to profit. The NHS trains our doctors and nurses and provides the first line of defence with accident emergency units. This isn't profit making, so private companies won't get involved at that level. They'll poach the staff who've been trained at our expense and use A&E as a feeder for new business. Private medical companies won't cover you for pre-existing conditions, so the older and more unhealthy you are, the less likely it'll be that you get any benefit. But they'll happily see you bankrupted while they squeeze every penny from your bank account. And don't think for one moment that increased privatisation will lead to a reduction in your national insurance payments. The NHS doesn't only need funding, it needs a healthy population. But we've recently seen a return of rickets and scurvy, both a result of bad diet. And last year, thanks to high food prices, and over 10,000 people admitted to hospital with malnutrition. We know prevention is better than cure, around 3 times as cost effective. But what does this government care about that? Did you know that at festivals, various charities backed by the music industry were checking people's drugs to make sure they were safe? Whatever your opinion on drug taking, this saved lives. But these fuckers in charge of the country have banned it being done. Lives will probably be lost, and costs will be incurred by the NHS, all because of political choices. High energy bills have led to hypothermia and more respiratory diseases as a result of damp conditions. We need a functioning care system too, so beds aren't blocked and people have some dignity. More district nurses, maybe, better paying conditions for care workers. They even managed to cut the workforce thanks to Brexit, and they're keeping it low by not paying them properly and making them work in shit conditions. They refused to talk with the staff to end the strikes, and now they've made an offer. It's take it or leave it, not even a pretence at negotiation. It's all done to give the impression it's the NHS that are failing us, not the government. That way they can introduce privatisation as a way to improve the service they've destroyed. But it's not just staffing that's a problem. Remember that promise of 40 new hospitals? It's not happening, of course, and the hospitals are in such a bad state that nearly half have had to close wards with structural issues. The repairs needed will run into billions, and this is due to a lack of investment. The health of the nation is heading in the wrong direction, not because the NHS, but due to political choices this disgusting excuse for government has made. The NHS is a perfect example of manufactured disaster capitalism, and it's playing out right in front of our eyes.